about the systemic disorders which are affecting the kidney. So initially we'll see about hypertension and diabetes mellitus. So hypertension, be it a benign hypertension or a malignant hypertension, is going to affect the kidney. So in benign hypertension, the kidney will have a classical appearance. Both the kidneys are going to be shrunken symmetrically. So bilateral symmetrical kidney is one of the features we see in a benign hypertension. And here the appearance, if you see, it is all having this dot kind of appearance, right? So it appears like a leather bottle. So it is also called as a leather grain appearance. Okay. While in a flea-bitten kidney, we had already was seen in many other conditions, including malignant hypertension. So flea-bitten kidney in malignant hypertension, leather grain appearance in benign hypertension. And the microscopic features are also kind of different. So in benign hypertension, you are going to have hyaline arteriolosclerosis. So this is the vessel lumen actually, and this is all the vessel wall only. And this vessel wall here, if you see, there is going to be some pinkish amorphous material deposited. So this hyaline material which is being deposited is the classical feature of a benign hypertension. So any of the kidney biopsies usually you take in elderly people, you will have some amount of hyaline arteriosclerosis if the patient has a history of hypertension. But in malignant hypertension, if you see, there is going to be something called as hyperplastic arteriolosclerosis. So in this image, if you see, it is having somewhat an onion skin kind of an appearance, right? So this hyperplastic arteriolitis is because of the smooth muscle proliferation. So this entire layer of this is the vascular lumen, which is very much narrowed, and this entire vessel wall is thickened because of the smooth muscle proliferation. All this proliferation of the smooth muscle is going to appear like an onion skin, and there will be associated fibrinoid necrosis and thrombotic microangiopathy. So some kind of fibrinoid necrosis or thrombus formation will be present inside this vessels. So all these three features together will constitute the classical features we see in a malignant hypertension. Okay. Next, we'll move on to diabetes mellitus. So diabetes mellitus is very common in our country also. So in fact, we are the diabetic capital of the world. So the most important thing which we want to predict for diabetic complication will be the duration of the disease. So under diabetes mellitus, we have various complications related to the microvascular and macrovascular injury. So under microvascular injury, you have retinopathy, nephropathy, and neuropathy. So the nephropathy alone will be dealing it here. So the complications of this diabetes mellitus is all related to the duration of the disease. Longer the duration, worse will be the stage of the renal disease. And the earliest lab findings, if they ask, it is going to be elevated glomerular filtration rate. While if they are asking about the histological finding, which is the earliest, then it will be capillary basement membrane thickening. So capillary basement membrane thickening we have already seen in membranous glomerulonephritis and also membranoproliferative glomerulonephritis. So other than that, in diabetes also we are having capillary basement membrane thickening. And the most common, we have various other things also like nodular glomerulosclerosis and diffuse glomerulosclerosis. So the glomerulus is going to be sclerosed, like pinkish deposition is going to be there. So obviously the capillary lumens are going to be obliterated and collapsed. So either this sclerosis will be having a nodular appearance like in here. So in this image, if you see, it is all having this nodular appearance. And that is called as a Kimmelstein-Wilson lesion, KW lesion. So this KW lesion is a classical and very specific histological finding for diabetes mellitus. While the most common histological feature you see will be a diffuse kind of, the entire glomerulus will appear pink. So hardly you will be able to make it out as a glomerulus at all on histology. So entire pink mass will be seen. And that is called as diffuse glomerular nephritis, glomerular sclerosis. And that is the most common histological finding which we see in a diabetes mellitus. Other than that, also we have certain findings like Armani-Epstein lesion. So Armani-Epstein lesion is nothing but subnuclear vacuoles seen on the proximal convoluted tubules. So in this image, if you see, this is the proximal convoluted tubule. So these are all the epithelial cells, and these clear cells which we see here will be the vacuoles. So this vacuoles is nothing but the deposition of the glycogen from the diabetes mellitus condition. So subnuclear vacuoles deposition in PCT is called as Armani-Epstein lesion seen in diabetic nephropathy. So other than that, we have some incidative lesions like capsular drops and fibrin caps. So under this, we have some pinkish material deposits on the capsule. So this is the Bowman's capsule. So near the parietal layer, we are going to have this pinkish deposition. So that is the capsular drops. Same kind of pinkish deposition if it is present on the capillary membrane. So capillary tufts, it is there. So these kind of pinkish deposition on the capillary membrane is going to be seen. That is called as fibrin caps. It appears like a cap, right? And on in the gross finding also, you can see papillary necrosis. So papillary necrosis is again caused by this diabetes mellitus. One of the causes for papillary necrosis will be diabetes mellitus.